Hey guys, let's move on with the chat about blood vessels. So the plan for this lesson is to start really general and look at the gross anatomy of arteries and veins, and then we'll get into some more specifics and how does the arteries and veins affect our vitals, like our blood pressure and our heart rate. So the purpose of the cardiovascular system is to circulate nutrients, oxygen, and waste products. Think of it like a shipping or a trucking company, carrying goods all over the world. So if we follow that analogy, the roads that those trucks would use would be called our blood vessels. Blood vessels go all over the body, carrying blood to and from organs. They're classified by arteries and veins, with arteries being blood vessels that travel away from the heart, and veins carrying blood back to the heart. As the arteries branch out, and they go from really big arteries to small arteries, the smaller ones are called arterioles. Likewise, when veins kind of go the other way and they start small and branch to bigger veins, those small ones are called venules. Between the venules and the arterioles would be this bed of tiny blood vessels called capillaries. It's here where the blood cells would drop off oxygen and sugar or pick up the products like CO2 and then head out to dispose of it. So if we look at this cross-section of an artery and a vein, they're made up of layers, similar to the nerves and the muscles that we talked about in previous chapters. The outer nerve is called the tunica externa, which is this elastic layer of connective tissue that protects the vessels. In the middle, we have the tunica media, which is the muscle layer of the blood vessels. This part of the blood vessel is made of smooth muscle, which can contract and expand to increase the pressure of the vessel. The theory is when the body needs to force blood to certain places or increase the amount of blood getting to tissues, these muscles can contract and squeeze. The inner layer is called the tunica intima, which is this very smooth layer of tissue. The reason it's so smooth, just like in the endocardium, is to prevent agitating blood as it passes through and causing blood clots to form. So think of it like a slip and slide or a water slide. It has to be really smooth, otherwise you're just going to get caught up. So let's quickly compare the layer of the arteries to those of the vein. So first off, you'll notice that the tunica media is way thicker in the arteries. This is because the blood in the arteries is traveling much faster and under higher pressure, because it's coming directly from the heart. It takes more strength to hold those vessels in shape, hence the thicker muscles. Blood in the veins travel with much less force since it's returning to the heart. We use our skeletal muscles to help the venous blood travel back to the heart. So by moving these muscles, it squeezes the veins and helps push the blood back up to our heart. So this is why, like when you're falling asleep in class, you get up and you stand and you move around a little bit, and you'll feel you start to wake up. To make sure that the blood doesn't fall backwards or pool into your feet or pool into different areas, the tunica intima veins has these small valves which allow blood to move forwards to the heart but not go backwards. Capillaries are really simple. They're just very thin vessels, basically just a tunica intima. In some places they're only 1 cell thick, so they act as this membrane that allow chemicals to enter and exit the bloodstream. Alright, so we've covered how the heart works and how blood vessels work. So let's start applying it. Blood pressure is the amount of pressure that's exerted on your arteries by the blood inside it. So if you've ever had your blood pressure taken, they put the cuff on your arm, they blow it up, and they give you 2 numbers, 120/80 or 100/70 or whatever. The top number is called your systolic blood pressure, and that's a measurement of the pressure in your arteries when your heart beats, called systole. So a heartbeat is also called systole. The bottom number is called the diastolic number, or your diastolic blood pressure, and this is a measurement of the pressure in your arteries when your blood's not being pushed forward, or when your ventricles have relaxed and blood's allowing to come back inside. So this is called diastole. So systole, diastole. A normal blood pressure for an adult should be around 120/80, and that's going to change depending on your fitness level, your age, and any other medical histories you have. Your blood pressure really is determined by 2 things, your cardiac output and your systemic vascular resistance. So 2 new words. Cardiac output is how much blood your heart puts out per minute. And it's just a math equation. You can figure that out by taking your heart rate, so how many times your heart squeezes per minute, and multiplying up by how much blood your heart pushes out per squeeze. And that's called your stroke volume. The systemic vascular resistance is a fancy word for the size of your arteries. So the bigger they are, the lower the resistance, the lower the pressure. Some things that can affect your systemic vascular resistance would be your sympathetic nervous system as we get jacked up and try and run, or things like arterial or atherosclerosis, so a hardening or fat building up inside your arteries, which make them narrow, which brings up your blood pressure. So what kind of things can lower your blood pressure? Well, if you're bleeding and you don't have enough blood to circulate, that's going to cause you to have low blood pressure. That's called hypovolemic shock. The word hypovolemic means low fluid. So this could also happen if you were really, really dehydrated. If your heart wasn't beating properly, maybe from an arrhythmia or a heart attack, that would also lower your blood pressure. And this will be called cardiogenic shock. Finally, if you have a problem controlling the size of your blood vessels from a massive infection or an allergic reaction, or you've damaged like nerves in your spinal cord and we can't control how big these muscles get, you'd call that distributive shock. The common term here is shock, which means a lack of perfusion or blood getting to your tissues. For the paramedics in the room, shock is our bread and butter. We're going to see it a lot, and you're going to spend a lot of time in class learning how to fix it. For the other healthcare professionals, you still need to know shock. You're going to see it for sure. But your role might not be as much of fixing it as early recognition and getting them to help when they have signs of shock.